I am Fungai Ndemera, born in Zimbabwe and moved to United Kingdom in April 2000. I came here as a migrant nurse and I came to work. And I worked in the UK hospitals and care homes for just about a year. And in 2001, I got into business. And guess what? The journey was that simple, making that decision that I wanted to make a difference. My why then was very different to my why now. Point to make. It's okay for you to be clear about what you want at the beginning of your journey or whatever stage you are. But your why will move and will change depending on what stage in your life you are at. For me then, my why was to make a difference to the poverty that I had left at home. I wanted to transform my family's life and legacy, and I wanted to be the light. I wanted to be that person who would pull everyone out of poverty, because I had experienced poverty growing up in a little town called Rimoga Kanoma in Zimbabwe. And so that was my why then. I was determined. I had a dream. I wanted to build my mom a big house. I wanted to change her life. I wanted my parents to live a very different and better life. And so I wanted to be that change that I wanted to see. As I continued with my journey as an entrepreneur from 2001 to around 2003, we got our first NHS contract as a supplier for healthcare staff. And I remember then getting very excited about the transformation that I was bringing into the NHS hospitals. And I remember the impact that our staff were making in the hospitals. At that point, I was a staffing supplier, a human resources supplier. So I would supply allied professionals, doctors, nurses to fill in the gaps that were being experienced in the NHS. And the place where I arrived and lived together with my husband was Wolverhampton. So I've never really left the West Midlands. I have always lived in Wolverhampton, and guess what? Even today, my offices are based in Wolverhampton. And I am grateful for the impact that Wolverhampton University made. At that point, my husband was the lead entrepreneur and I was the registered manager and the business development manager. In 2004, my why changed. And you know why? It was because I lost my father and my father-in-law a week apart. They were both non-hypertensive patients, but they had undiagnosed diabetes. And so I went through a difficult time of trying to understand what had just happened. And it was very difficult for both of us to process. But what I realized was, maybe this was an opportunity for me to look deeper and turn the anger and the frustration into understanding why this had happened. And maybe I could use that energy to figure out how I can be the change. And so since then, my why became different. I decided I wanted to pursue a journey that would help me understand why Black men and why ethnic minorities were suffering the most from diabetes and hypertension. This coupled together with the shortages that were happening in the NHS. That gap was growing, and as a supplier to the NHS, it was starting to be very difficult to find the doctors and especially the resources that would work and support patients. So the lesson here is, through our most difficult and frustrating times, new dreams and new opportunities can be born. The difference is, which lens do you choose to use to look at everything? And which energy do you choose to feed? At that point for me, I chose to feed the anger and the frustration with positive energy so that I could be the change that I wanted to see in the healthcare system. So fast forward, From 2004 to 2009, I was on a journey of finding myself. And it was a very dark journey. It was a very difficult journey because I was trying to find a new reason to live, a new reason to work, a new why to push forward and wake up every morning. And so the lesson here is, sometimes you will feel that you are in a dark place and it's okay. And sometimes you will feel that you can't find yourself and it's okay. What is important is when you are in those dark moments is for you to find that light, that one thing why you must wake up, that one thing why you must push forward, and that one thing why you must see the world from a positive place and decide to be the change of those things that you don't desire and those things that you don't like. For me, looking at everything from that lens changed everything. And that's how Fungai, the health tech entrepreneur, was born. I started to go on a path. How could I multiply the time that doctors have? How could I make it possible for patients to access doctors regardless of their location and regardless of where they are? How could someone access a doctor if they needed one straight away in real time? Because I didn't want another man or another woman to experience the death that I had experienced. And I didn't want anyone to experience that pain because it had been such a dark experience. And so through that lens, I made a decision to pursue a journey. I could find people who could write a system that could help me achieve this goal, that could help me pursue this why. Then that would be my big reason to wake up. And so ever since then, that has been my goal of trying to make doctor's appointments accessible regardless of location, place, and time. Reducing missed appointments, ensuring that people with chronic diseases, they have got management strategies of how to manage their health, access the doctors, and ensure that we reduce the risk of dying or reduce the risk of premature dying. And so as of today, this is what makes me wake up every morning and want to go to my office, want to go on my desk, want to invest in startups, want to mentor other people, start businesses and be the change that they want to see. And this very reason is my big why I do what I do. And so I am super blessed that along my journey, I've met amazing people. I've built amazing teams around me. I've got an amazing support system that believe in this dream, and every day we wake up to meet at our offices or to meet across Teams or across Zoom or whatever tools that we use to meet. And we've got that one goal, to change healthcare and make healthcare equitably accessible for everyone. And so that's why I'm excited about my product called CheckUp Health, an AI-driven one-stop hybrid clinical system that comes with a clinical dashboard and patient-facing apps. It allows primary healthcare services and GP practices to offer digital services to patients, making appointments available, making patients have access to appointments so they never have to miss them, because it comes with multilingual options, allowing patients to access doctors in their languages so they don't have to worry that they don't speak English. So, oh my gosh, I'm gonna not be able to express myself. It allows that, and currently as we speak, it is in 6 languages, and we aim for it to be in 20 languages by last quarter of 2023. So there you have it. That's how I, Fungai Ndemera K, became a health tech entrepreneur. So thank you so much to everyone who've supported me on this dream and on this journey, and I'm forever blessed and grateful for all the awards I've been nominated for in 2023. I have been nominated for the Black British Business Awards in the United Kingdom. Thank you so much, Black-owned Birmingham, for the nomination. I'm forever grateful that our software solution has been chosen as one of the companies to be entered in the NHS at 75 publication celebrating how far the NHS has come in supporting patients and meeting healthcare needs of patients in the United Kingdom. And this is an amazing opportunity for us to understand how far the NHS has gone, the work that they are doing to make healthcare equitably accessible for all the patients, and them considering younger companies and upcoming companies to be included on this journey. I'm forever grateful for the support that our product CheckUp Health has received from renowned organizations, including Innovate UK, who funded one of our projects for remote health monitoring for chronic diseases specific to diabetes and hypertension. And grateful for the adoption of our solution in the NHS, supporting NHS GP practices with overflow services. I believe that with a big why in the center of what we do, we can be the change that we desire. So what is your big why, and what keeps you awake at night? And what makes you wake up every day? I would love to know. Leave your comments below, and thank you for listening to my story. I would love to hear from you through my YouTube channel, my Instagram, my TikTok, and my LinkedIn. And my name is on the screen.